Have you ever heard of perinatal depression? It's a condition that affects many new parents during pregnancy and after childbirth, also called the perinatal period. Anyone can experience perinatal depression. Research shows that it affects about 1 in 8 women and gender-diverse birthing people during the perinatal period. It can start before, during, or after pregnancy, although the first few months postpartum is when the risk is highest for a new episode of depression to develop. The strongest risk factor is a past history of depression or other mental health problems, especially if it wasn't fully treated prior to the perinatal period. Other major risk factors for perinatal depression include a family history of perinatal depression, lack of social support, and stressful life events such as financial, relationship, pregnancy, or infant health problems. Experiencing negative emotions doesn't necessarily mean you have depression. You may have temporary mood changes in pregnancy and postpartum that come with increased stress but go away quickly. After giving birth, some people experience the baby blues, which can include tearfulness and feeling more emotional than usual. Baby blues usually go away on their own without treatment by the end of the first month postpartum. In comparison, perinatal depression is more severe and persistent. For example, the negative thoughts and feelings that come with depression are more distressing and harder to get rid of. They often have a really big impact on how people function in their day-to-day lives. Depression can be experienced in unique ways during pregnancy and postpartum, in addition to how you would experience them otherwise. Outside of the perinatal period, symptoms of depression can include sadness or hopelessness, loss of interest in things you are usually interested in, feeling worthless or very guilty. There are also many physical symptoms, some of which are hard to separate from symptoms of pregnancy and the early postpartum. And in more rare cases, thoughts of death or suicide, with or without a suicide plan or an attempt. There are some unique ways that these symptoms are experienced in pregnancy and postpartum. For example, mood changes can show up as intense irritability or anger, in addition to or instead of sadness. You may feel emotionally numb or not feel connected to your baby, other children, or your partner. You may not be able to eat enough to put on enough weight during pregnancy or to maintain milk supply and lactation. You may not be able to sleep even when your baby is sleeping. You may feel more restless or slowed down or tired than would be expected in pregnancy. You may have very negative thoughts about your capacity as a parent, for example, being very critical or doubtful of yourself, or feeling like a failure. Excessive guilt about your parenting choices or actions having a negative impact on your baby. Feeling very overwhelmed and that it is hard to make small decisions with regard to pregnancy or with the care of your baby. Thoughts about harm coming to your baby, by accident or on purpose. Most of the time when people have these thoughts, they do not intend or plan to harm their baby in any way, but the thoughts can be very scary. Sometimes when people are very depressed, they have thoughts about not wanting to live anymore, including that their baby might be better off without them. If you think that you may have any of the symptoms of perinatal depression, it is important to talk to your healthcare provider or trusted person right away, because depression in pregnancy and postpartum is highly treatable, including with increasing your supports through counseling or therapy, and sometimes with medications and other treatments. If you are thinking of suicide or of hurting yourself or your baby, please seek immediate help. You can call or text the Suicide Crisis Helpline 988 in Canada or the US. You could also dial 911 or go to your nearest emergency department. Remember, you are not alone, and help is available. To learn about how to prevent and treat perinatal depression, you can watch part 2 of this video at canmat.org. You can also download Seeds of Hope, which is a guide to mental health issues in the perinatal period, and access other resources related to the 2024 CanMat Guideline for Perinatal Mood, Anxiety, and Related Disorders, such as information on diagnosis, symptom scales for you to fill out, and more videos in this series.